Welcome back to the Retire with Confidence podcast. We are super excited to have Lily Vittayarukskul join us from Waterlily. Lily, how are you doing?
I'm doing pretty well. It's Friday, and then excited to get some plans started for the weekend.
Awesome, awesome. Well, we have Lily on today specifically to talk about long-term care and everything that she is doing on the technology side, which is super exciting because long-term care, I think, is actually the trickiest piece of retirement planning because you really don't know what the exact right answer is until you're finished, until you're done with long-term care. You don't know how long you're going to be have a long-term care need or how long you're even going to live, and so it can be challenging to figure out, gee, how likely is it that I'll need long-term care, and what's that going to cost? And like I said, I think it's the trickiest piece to plan for. But Lily is developing or has developed software with an AI component that can really help us look at what is most likely the cost based on family history, your health, all sorts of different variables. So I'm really excited to talk with you about this. But Lily, give everybody a little bit of your background before we dive straight into the software, because you had your own personal event that kind of drove this, and then you combine that with your educational background as well.
Yeah, definitely. So I'm the founder and CEO of Waterlily, and I founded the company with the core question being, how can we help families mitigate the devastating effects of caring for aging loved ones? And it's a hairy topic. I usually don't recommend every professional to go into it because it's hard. And the only reason why I'm into it and I'm passionate about it is because I had my own personal experience on this topic where we had to navigate care for one of my loved ones in my household for a little over 2 years. It was specifically my aunt. She's a first generation immigrant, like my parents. And so she helped raise me growing up, was essentially like my second mom. And unfortunately, when I was 16, she was diagnosed with terminal stage colon cancer. And so it was a really brutal battle for us to not only witness, but to really be just dove right in out of left field, and it was incredibly devastating for us, both from like a physical burden standpoint, that we stepped in physically in ways that we didn't expect, that the doctor couldn't have prepared us for, really. It was very financially devastating in that we went into a lot of debt. We paid a lot of money out of pocket because a lot of things were not covered by health insurance, which a lot of people assume about alternative treatments, including long-term care needs as well. And the piece that made me really pivot my career previously in aerospace engineering, so Dave, you hinted at like technical background, into healthcare, was the amount of broken family relationships that occurred, where every single person had such a strong opinion about what the best form of care for her would look like. And so we it ended up creating such deep rifts in our family where there's just relatives that we haven't spoken to in a little over a decade since that's happened. So that made me really aware of just like how broken this topic is, because not every household is going to go through cancer, but a lot of the same themes that we went through is what every single household is likely going to go through when taking care of an aging loved one, which is the way I look at long-term care.
Very sorry to hear about the family rift and, of course, about your aunt that passed away. Sounds like that was a very powerful time for you, and like you said, that really drove you into the healthcare space. And now
Yes.
out of that, you've developed this new company that seems to be going strong already, and really making an impact in a lot of planning for the
Mhm.
long-term care, not only the dollar amount, but figuring out who's going to have to do what, and how many hours is that going to take. Can you tell us a little bit about that?
Yes. So when I first started the company, I just wanted to make sure that I just wasn't building for my own problem and I wasn't solving for myself. And so I went and interviewed hundreds of households actually across different demographics and cultures and whatnot, to make sure that those core themes of physical, financial, and burden and broken family relationships was also potentially common, just so I could understand their pain points. And I was able to validate that those are core themes. Now the question was, how do we go about solving for them? And so instead of what currently happens in the healthcare space, which is a lot of families just tackle this problem incredibly reactively. Like they don't touch this, they don't plan for it until, wait, mom fell down, she broke a hip, she's in a hospital. What do we do next? And that experience then progresses into 4 years of intense care that's usually falling on the children. I realized that like that was just a trajectory in healthcare, and that's what all kind of like families wanted to initially, talk about, which is like, oh, this is important, like, but how do I even know what even to prepare for? And so I combined that insight in addition to the core of the company, which is how do we prevent devastating effects, and we think that happens through planning. And so the only people we recognize that does planning on this topic, there's already existing planning infrastructure, is on the wealth management side with financial advisors. And so I'd love to hear from you, like, what are the key pain points that advisors, have on this topic? And I could speak to just how we develop a solution from hearing those pain points.
Yeah, clients is just trying to understand, gee, if I need long-term care, what's that even going to cost? What's it even going to look like? And do I need to fund it with insurance, or do I have enough money in my retirement savings? And oftentimes we even talk about somebody's house as being a bit of a supplement to help cover long-term care costs, because there's different ways to get money out of the equity in your house, or if you have to go into assisted living or something, you sell your house, you have that value. So we'll talk a lot about pieces like that where we say, okay, well, if you have a long-term care event, let's look at what insurance coverage you have, if any, because long-term care insurance can be very tricky and a lot of people don't even necessarily need it. But then also look at, what assets do you have to pay for it? What's the house value as an asset? There's lots of different pieces that we can look at to kind of cobble together how much you need to cover the cost. But I think the next pain point, which is what you hit on, is okay, like who takes care of this? Who organizes it, and then who actually delivers the care? Because I think most people, when they think of long-term care, they just assume that something happens and I go to a facility and I know that's going to cost a lot of money. But
Mm-hmm.
that's not always the case from what you've experienced. A lot of times there's some at home care, maybe done partially by family, partially by a professional. And maybe at some point it moves to a facility with less family involvement and things like that. So it's not just okay, I have long term care need now. I'm going to physically go and stay somewhere, and that is my long term care. There's a lot more nuance and details to that, which is sounds like what you found even in your interviews across the country.
Yeah, we found that in our interviews, and then we doubled down on that and try to build something powerful that could actually predict, all the biggest anxieties that families had on this topic, in addition to advisors that are trying to get ahead of, like, those questions that their clients have on this topic, which is like, how relevant is even this topic to me, around like, what age should I be preparing for it so I could be really efficient with, like, what is that cost analysis? And the most important piece is like, what is this event going to look like? And so tapping into just like what we call the intensity snapshot, which is like, how many hours of care over the span of how many years is someone going to have a long-term care event? So we double tap into that, and show you the default with the massive amount of data that we've gathered on this topic. That a lot of that care actually happens in a family, regardless of if someone has 2 million in investable assets or 500K or 5 million. It surprises most families that, even if you financially have enough, you will involve the children if you don't actually talk about it ahead of time or plan for it. So it's not just a financial topic, it's really a family topic as well.
And ideally, this is all planned well in advance. Not that you can plan everything absolutely perfectly, but you have these
Yeah.
discussions of, okay, it's probably going to involve family help of some sort. How are
Yeah.
we going to cover that? Who's going to do what? And just have those discussions in advance. That way it's not, as you said, somebody falls, breaks a hip, and now everybody's scrambling to figure out
Mhm.
what to do.
We look at it as a I guess like high level conceptually. What's really important is there's a lot of defensiveness on this topic, and so we wanted to remove that. There's all types of defensiveness. The first one is the fact that a lot of clients don't really understand what long-term care insurance is and what does it cover and why is it relevant. And so when advisors talk about insurance products, they immediately feel like, wait, you're just trying to sell me something that I obviously, don't need. And a part of that is because, they weren't motivated in the first place. So we break up, we recognize the topic today is like needs assessment and product assessment. So we break that apart and we don't focus on the product assessment. We purely focus on what is the needs and intents and wants of the family on this. And we focus our AI models and insights on preparing a client or giving them a sneak peek into not national averages or zip code calculator, which is the state of things today, but actually, hey, client, do you mind if we ask you about 2 dozen questions about your basic demographic, basic health, basic financial to really learn who you are so that we can then map you to our massive data set of so many households that look like you that already went through a long-term care event and opening that up as your story. And then we tell you like what is your personalized likelihood, how many hours is a family going to step in, and how much that's all going to cost. So we think that could solve for the first barrier people have, which is why would I prepare? I don't know what to be preparing for. So we show you what to prepare for, but where things get really exciting is for the first time ever, we're also understanding like what are the variables that could actually change that outcome. So when you learn your own story here, common fears that people have is, well, that's way too expensive. How am I supposed to be able to afford that? Or two is just like, wait, I thought long-term care was just, to your point, going into a facility and maybe doing a reverse mortgage to be able to pay for it. But wait, you're involving my children. How are my children involved in this? And how do I have that conversation? So we actually focus on building out these mini planning modules for the advisor to um, guide through how do we kind of change levers of affordability or care preferences on this topic, and what does that actually entail from like the family perspective, or where are you going to live and how that affects cost. And we try to make it as easy as possible.
Yeah, it sounds like you start with understanding the person and what their specifics are. Really map that up with actual experiences that the data has. The data shows like, hey,
Mhm.
these people have a similar health, income, all that to what you do. This is a likely outcome based on what we've seen historically. Like you
Mhm.
said, it's much more detailed than just going on a website and saying, "Oh, I live in St. Louis, Missouri, and here's my
Yeah.
local average for cost, and let's go with it." That's a good starting point, perhaps, but you can dive much more deeply, not only into what's it going to cost, but like you said, how does family get involved? And then step
Mhm.
two sounds like if they say, well, we don't want family involved as much, or my kids are all out of town and can't do as much, then you can change those inputs and say, okay, well, then you're going to incur the cost of a professional to help. And what does that look like?
Yeah.
Is that a fair statement?
That is exactly the fair statement. I think what was really important about the software, and I think what we could translate into like actionables for the advisor to even have on a conversational level, is understanding that family relationships play such a massive impact on how much is this going to cost and how prepared are we actually on this topic. But also for the client individually, for them to really think about this topic themselves, because, you know, knowing that you want to age at home, you're not exactly set up like a retirement community or facility with everything you need, and you may not know that who's going to coordinate your care in this case, who's going to manage your finances, if you couldn't do that, yourself. And so I think the logistics of really building out your care plan to the best of your ability really helps the advisor or your family really understand what to be preparing for from a financial perspective, as well as like ensuring you hit your like quality of life that you're expecting during this like difficult and vulnerable time.
So, is there anything that you have seen where you could say doing this or doing these couple of things will really set you up for success in long term care planning? Is it as simple as saying, hey, we need to be aware that there's more to this than we might think? Or what have you seen that says, hey, we really need to focus on this or these couple of things to
Mm-hmm.
help make this more successful to plan for and execute in the end?
Yeah, I think the first thing is overcoming a lot of key biases that people have on this topic. which is like one is like, oh well, long-term care health insurance is going to cover that, right?
Oh,
And so like that's
yes.
the first major thing we have to get over, which is one is like what is really like long-term care, and a lot of to say it as cleanly as possible, it's the fact that like you age and you start to have difficulties with like things that you were able to do that helped you stay independent, like being able to like walk around as easily, being able to get in and out of like bed, being able to like shower or bathe yourself, things like that becomes harder when you have physical limitations that come from just aging, or you might have cognitive limitations. So that's what long-term care is. And what's surprising to people is they think, oh, that's health and that's healthcare. And that's like, like Medicare is going to cover this for me. And it's like, it's not. And so the next question becomes, well, if my insurance doesn't cover it, uh, that means that we have to build a real plan around this in some way. So can I better understand can I get a sense of like what likely are my needs going to be? So you can still do this with like more of the basic tools like national averages, zip code. You can get a gist of just like around how much it could cost, and around what age or like whatnot. But the things that the other, I guess, two assumptions I'll put out there is a lot of people assume, one, oh, that like I have enough funds, so definitely my kids are not stepping in here, when in truth, when you lose cognitive and motor ability, like who do you trust the most to make decisions on your behalf? Like, because when that doesn't happen, what the healthcare system will be optimizing for when you go to the hospital, what people don't know is that they're going to optimize for keeping you alive for as long as possible, no matter what. That's why you have to share your intentions ahead of time through advanced directives or setting up a proxy, or you think someone else can make really great decisions on your behalf. The other thing that people assume is like, oh, well, I don't have to talk to my family about this because if anything ever happens to me, my daughter will figure it out. My son will figure it out. And that's just not true. There's so many skills that you need to develop. There is like their own life, responsibilities that may affect their ability to take care of you. So what if they end up being a really bad fit for this role, and you only knew that the moment you needed care? Like how's that going to affect the quality of your care? So I think it's both, for yourself and for your family.
So on this, but just talking about quality of life versus quantity, and that's becoming, I think, more and more of a discussion. Is and I don't know that anybody has the exact right answer, but I think to your point, you just need to make your intentions known. That okay, well, at what point do you want to say goodbye, and what point do you want to keep on going, and just have that clearly spelled out, even
Mhm.
in your healthcare power of attorney, things like that. It's just really important to be very clear about what you want to have happen to you, because when you need the care, you probably aren't going to be the one who is able to respond at that point in time. You need to have this well thought out in advance in terms of exactly what you want to have happen and when.
Mhm. Yep, exactly.
And
And
you have, go ahead.
oh, sorry, no, go for it.
No, I was going to say you have a whole bunch of resources on this on your blog. Is that correct?
Yes, that's correct. That even though the software right now is focused on how can we serve advisors, at least like for right now, we have an entire blog that speaks to this concept of like aging care, financial planning, and different pieces of it, which is, if Medicare is not going to cover my care, then what are other like programs, whether it's insurance or maybe government programs, that could actually like step in here, because that could massively affect how much do you actually save for. Or we also have like a checklist of like, mostly because a lot of that burden falls on the children today, and very reactively, a lot of children think about this topic and they're like, well, I have aging parents, I don't know how that's going to affect me. So we illuminate insights around there, as well as offer checklists and guidance on what is step by step, how do you go about maybe having a conversation with your parents, how can you make it empathetic to them. So we have some major categories like that are just free to for anyone to read.
It's just at joinwaterlily.com.
I hope I get this right. You could go to joinwaterlily.com, so it's spelled like join and waterlily like like the flower itself.
Yes,
And there's like a button that says blog, or the other option is blog.joinwaterlily.com as well.
got it. Yeah, a lot of resources out there. So, like you said, even if you're not an advisor, it's good to go check that out just to get an understanding of things to think about. Heck, even if it is your parents that you're thinking about, it'd be good to go and look at those resources and get an understanding of what it's going to take to handle long term care, not only financially, but also personally.
Yeah, I think probably one of the most meaningful resources I could probably direct someone to, that might be listening, is also just the types of caregivers there are.
Mhm.
So, whoever in the family like may step in, whether you're stepping in on behalf of your parents or you're thinking about your children, there are many distinct types of ways in which they can step in, not just medically or financially, but maybe they don't do the physical care. And there's care coordinators, or maybe they help out emotionally because it's such an emotionally stressful topic. So yeah.
Well, Lily, I appreciate you joining us very much. That was a lot that we covered. Very difficult topic. But I love what you were doing in terms of not only gathering the data and being able to show individuals and advisors, like, hey, this is what it's going to cost, this is what it's going to take in terms of manpower, but also then turning that into actionable items in education. So thank you for everything that you're doing in this area. It's not an easy area. I think you're doing a great job.
No, I really appreciate that. Thank you for having me onto the show. I really enjoyed the questions that you like asked, and of course, like if anyone wanted to like get in contact with me and like learn more, we should be very easy to like contact either through our website. You have like burning questions, you have burning concepts that you want us to like answer in our blog or things like that. Like, yeah, more than happy to. And really care a lot about this particular topic.
Awesome. Thanks again for joining us.
Yeah, thank you. Thanks, Dave.